Hello and welcome to our Mums and Bubs Pilates Group presentation. My name is Edwina Oliver and I'm one of the paediatric physiotherapists that works at Wimmera Healthcare Group. Today's talk will focus on your little ones, including some different conditions to be aware of, milestones, tummy time, and when a referral to a physiotherapist is indicated. We would like to acknowledge the traditional owners of the land on which we meet today and their elders past and present. We acknowledge and pay our respects to the 5 traditional owner groups of the Wimmera region. So today I'll be discussing conditions which include plagiocephaly, torticollis and hip dysplasia. I will also go through some different ideas around tummy time, what the sleep service here in Horsham is about, milestones, different equipment that are available on the market, and when you may require a physiotherapy assessment. Plagiocephaly is a condition that is characterised by an asymmetrical distortion of the skull, typically from the flattening of one side of the skull and causing the other side to protrude. It can also be associated with ear misalignment, forehead protrusion, and facial asymmetry. Whilst plagiocephaly is purely a cosmetic deformity and doesn't have any impact on learning or brain development, it does present with issues later on in life, such as the ear misalignment, which can make things like wearing glasses difficult. For SIDS prevention, infants must sleep on their back at night. The SIDS guidelines has seen a dramatic decrease in the number of cases of infant death related to SIDS. However, this has led to nearly a 50% increase in plagiocephaly. Risk factors for the development of plagiocephaly include male, firstborn, multiple pregnancy, prematurity, an increase in fluid during pregnancy, supine sleeping, torticollis, less than 5 minutes of tummy time a day, delay in motor skills, preference for turning head to one side, especially during sleep past 6 weeks, and positioning to the same side for feeding. Things to look out for in your own bubs includes a strong preference for looking one side, difficulty in you turning their head to one side, flattening spot on the back or one side of their head, and areas where hair may have stopped growing. There are a number of ways to help you prevent the development of plagiocephaly, and these include tummy time and sideline during supervised awake periods of play, changing the position you play with your child to encourage them to turn their head to each direction, alternating the way you hold your child when walking around and when feeding them to continue to encourage them to look around and move their head to both sides. Nightly, weekly alternating head positions during supine sleep. It is imperative that they still sleep on their back at night though. Regular position changes in the cot in the room and moving toys, mobiles around cot. Avoid prolonged repetitive position in lying, such as car seat, carrier, buggies, baby swing and bouncers. Make sure they are spending short periods of the day either carried or in tummy time to offload their head. Make sure to seek advice from a physiotherapist the moment you are concerned. This may include only noticing a strong preference to look one side. The earlier the condition can be detected and monitored, the more likely they are to recover with a more rounded head shape. Torticollis is another condition that can affect your baby. It is where one of the muscles in the neck tightens and prevents your baby from being able to move their neck fully to both sides. It almost looks like your baby has a twisted neck, where they may appear to rest their head in a tilted and rotated fashion. While it is perfectly normal for an infant to have a strong preference to one side, it is important that they can move their head fully to the other side to prevent this condition occurring. This condition is strongly associated with plagiocephaly, but other risks include hip dysplasia, foot deformities, multiple pregnancies, difficult birth, and family history of the condition. Torticollis is the third most common congenital musculoskeletal deformity, and the incidence lies between 0.3% and 1.9%. There can be many causes of the condition, but the most common is the tightening of the neck muscles or a lump within the muscle itself. If you notice your child has a strong preference to look one way, struggles to move their head to look to the other side, and appears to rest their head in a tilted fashion, it is important that you call and see a physiotherapist. We provide gentle stretches to help with the head movement. The other way to prevent this condition is similar to plagiocephaly, which includes tummy time and changing up the baby's position during play and in the cot for sleep. Developmental hip dysplasia is a condition in which the hip socket is quite shallow and doesn't fully develop to cover the ball portion of the thigh bone. This leads to a hip joint that is susceptible to dislocating or popping out and isn't very stable. It occurs every 2 out of 1,000 births, and risks include being female, firstborn, a breech presentation, excessive fluid in pregnancy, and family history. Things to be aware of include difficulty in moving the baby's legs out during nappy changes, uneven or differences in skin folds on the thigh and glute region, or the joint feels stiff and can click or clunk. If concerned, make sure to raise this with your maternal child health nurse or GP at their 6-week checkup. Infants under 6 months of age undergo an ultrasound, which will measure and detect hip dysplasia. The earlier the condition is detected, the easier it is to manage. Typically, it will be managed with bracing, but older children sometimes have to undergo surgery. Missed developmental hip dysplasia is one of the causes of early osteoarthritis and cause of early hip replacement in adulthood. Please note that whilst most children are born with the condition, it is considered a developmental disorder, meaning it can take time for the baby's hips to grow and the condition to be made present, so continuous checks of the hip as your child grows is important. It is important when wrapping your infant to allow movement of their legs from their hips, as this frog leg position assists in the development of the hip joint socket. Always raise any concerns with your maternal child health nurse and have their hips checked at their 6-week follow-up with the GP. Positional talipes is a common foot condition in newborns and can affect one or both feet. In positional talipes, the foot rests in a downward and inward position, as shown in the right bottom picture. However, the foot should be flexible and movable. The condition is thought to be caused by the way your baby was positioned in uterus, resting with their feet curled up. The condition will normally resolve on its own, but you can do gentle stretches, bringing the baby's foot upwards and outwards. If you are concerned, it is important to have the baby's feet checked by a physiotherapist or GP to make sure there is no structural reason for their positioning. This condition does not cause any issues to the baby when they start walking. Tummy time is an important part of your child's development for a number of reasons. It not only prevents the mentioned conditions such as plagiocephaly or torticollis, but it allows your baby to work and build strength in different muscles, including their neck to lift their head and arms by pushing up in front. It also sets the stage for motor development, as it increases their senses and body awareness, which will allow them to eventually roll, sit, crawl, and walk. Tummy time can be started straight away, and there are many different positions you can try. Not every child will like tummy time, so it's a matter of completing it within your child's preference, like short bursts throughout the day or maintaining them for extended periods if they're happy. Some helpful tips include ensuring your baby is content when you start and doesn't have a full belly. If they become upset, try soothing them first, but otherwise you can remove them and place them inside lie for a period of time before trying again. Like I mentioned, not every child will like it, but it's important to persist with it. It helps to place a rolled up towel under the baby's arms as seen in the middle picture. This helps to clear their head from the floor. It is okay if your baby at the start is only lifting their head for a short time and then resting to the side. The benefit is that they are still spending time in this position and taking pressure off the back of their head. You can also try lying your baby on your chest with yourself on the floor or across your lap for alternative positions. Try getting down on the floor with your baby and using toys they like. You can even try placing a mirror in front of them, as this can also help. Start tummy time straight away, as over time your baby will get used to this position. Aim to complete 5 to 10 minutes every wake cycle. This doesn't have to be done in one sitting. If your baby only tolerates a few minutes, you can always move them out and then try again. If your baby enjoys this position, you may leave them there as long as they like. Always supervise your baby when completing tummy time, and remember that they need to be placed on their back when sleeping. Infants won't tolerate it for long at the start. It is important to persist with short periods and gradually increase the time spent on their tummy when they are awake. Every little bit counts. This slide just shows some different positions you can try, including carrying them on their tummy, placing them on your chest, or on the floor with a towel rolled up under their arms. As they get a bit older and show good head control, you may want to try on the floor without the towel and allow them to push up on their arms or over your lap with a pillow. When your baby is playing on their back, encourage them to bring their hands to midline and bring their feet up and hands to their feet. Like mentioned before, if your baby doesn't like tummy time, you can try placing them in side lie with a towel behind their back to stop them rolling. If your baby has a strong head preference, lie them on the opposite side, so they are spending time looking in that direction and taking the pressure off their head to the side they always look on. This position can also help facilitate rolling. When you place your child in these positions, don't be afraid to roll them in and out to allow them to get the feeling of this motion rather than just picking them straight up. This slide goes through the common milestones in regard to your baby's gross motor development. One thing to note, there is a huge gap in how long it takes for babies to generally reach certain development points. Every baby is different, and whilst there are some red flags that I will discuss later on, every child will develop at their own rate. We typically will see babies learning to lift their arms up first and then begin to roll, typically from side to back first. By 11 months, you will see crawling, and most children will sit independently by 7 to 9 months. We then start to see children pull to stand around 12 months, stand on their own, and they can begin to walk anywhere from 9 months to 18 months. Lister House Clinic offers a sleep service for children that have trouble falling or staying asleep. This service offers the following: specific for children from 6 months to 18 years, appointment in consultation with Dr. Wilson, Dr. Ranasingh or Dr. Garg, works in conjunction with your maternal child health nurse and general practitioner visits. The initial cost is $150. They do bulk bill all other appointments, and it is a half-hour appointment for 10 to 12 weeks or until sleep improves. Important features to look for when choosing a carrier include hips positioned in M shape, weight range suitable for newborns to toddlers, strong adjustable shoulder straps so that it can be worn firm and secure with bubs facing forward or inwards depending age and head control, sun protection hood and light and breathable fabric, and machine washable. You can always follow the TIC guidelines for carriers, which includes tight, in view at all times, close enough to kiss, keep chin off chest and support back. It isn't recommended to ever swaddle your baby or have their legs placed straight down. You want to aim for that nice M shape with their legs out to the side. There is some common equipment found on the market, including jolly jumpers, walkers and bumbos. In general, the Australian Physiotherapy Association does not endorse the use of these, as babies miss out on valuable floor time when they spend too much time in walkers and jumpers, bypassing important developmental stages such as rolling and crawling. These devices are passive and do not assist in helping teach your baby to walk, and there is concern around hip development and encouragement of walking on their toes. If you do own one of these, don't place them in for more than 5 to 10 minutes. Never complete more than once or twice a day, and always make sure that your baby is having enough time on the floor. If you ever have any concerns regarding how your baby is developing, whether it is their head shape, a strong preference for looking to one side, their foot posture, or their overall milestones, never hesitate to give us a call at Wimmera Healthcare Group. You may ask your maternal child health nurse or GP to refer, but you can always call yourself and do not require a referral. Things to be mindful of and alert a health professional to include your baby feeling floppy or stiff when handling them, your baby isn't tolerating tummy time well by 4 months, they were premature, they have a flat spot or balding, or there is a difference in each side as they move and they aren't symmetrical with their movements. Some milestones to be concerned about include they're not sitting by 9 months, they're not crawling or pulling to stand by 12 months, and they're not walking by 18 months. Also be mindful if your baby bottom shuffles to crawl, or if they have an unusual walk or foot posture, such as they in-toe or walk up on their toes. Thank you for listening. I hope you enjoyed today's presentation. Please do not hesitate to give one of the paediatric physiotherapists a call at Wimmera Healthcare Group if you do have any questions or concerns.